Hi everyone! If you have a lower back pain, you are not alone. Lower back pain is a very common problem in our society. With today's video, I might be able to give you some knowledge and practical advice to help you to fight this discomfort. Hey everyone, it's Dr. Lena. Welcome to Sport Health Science. This channel is all about giving you training, knowledge and tools to help you to exercise more effectively and make healthy lifestyle choices so you feel stronger, healthier and happier. Experts estimate that up to 80% of the population will experience back pain at some time in their lives. It can affect people of all ages, from adolescents to the elderly. The lower back, where most pain occurs, includes the 5 vertebrae in the lumbar region, which supports much of the weight of the upper body. A lot of people might think it is best to pause and especially not to do any exercises if their back is painful. But nowadays we know that exercise is actually highly recommended and it can help you to alleviate lower back pain. Of course, the exercises you do have to be appropriate. I would not recommend you to lift super heavy weights or train for your next marathon. It is really important that you find out what is causing your back pain. So please seek a diagnosis from your medical doctor or back specialist and then guide your training according to their advice. It is common for back pain to be a result of an imbalance between your muscles. So the logical step is to strengthen the muscles which tend to be weak and to stretch the ones that are normally tight. Do the exercises slowly and gradually and always listen to your body. First, I will show you specific exercises which help you to mobilize and to strengthen your muscles around your back, abdomen and hips. We are going to do each exercise for about 30 to 45 seconds. We'll take it easy, focus on quality and repeat every movement slowly and in a controlled way. Depending on your fitness level, feel free to repeat this mobilization and strengthening part maybe once or twice. Then I will continue with certain exercises to stretch tight and shortened muscles in that described area. If you feel increased back pain during an exercise, maybe that one is just not for you or not yet for you. In that case, take a break and continue with the next one. Now, get yourself a mat, maybe a towel and a bottle of water and you're ready to start. Okay, we start with a curl in and arm rotation. So open your arms, bend your legs slightly and then curl in, rotate in and open up. Breathe out, curl in, breathe in, open up. So we curl in with your upper body and then open up, stretch up. Our shoulders are ball and socket joints, so there's a lot of movement and a big range of motion which we want to warm up now and mobilize. And also due to the fact that we are sitting so much often in front of desks and with our mobile addiction being in this position, it's really important to open up and stretch up the chest muscles, which tend to be tight. Okay. Curl in and open up. From here we continue. Take your arms up in a U position. Slightly bend forward, contract your belly button, pull your belly button inside and from here we start with a small movement to one side and rotate to the other side. Trunk rotation. Especially the small muscles around our spine have to work. We're rotating. It's a nice mobilization exercise, great for the thoracic spine, which allows us a lot of movement. Keep on breathing regularly. Your back is straight. Relax your shoulders and rotate from one side to the other side. One last one each side. Great. Shift your weight on one leg. We continue with some balance exercise now. Lift up the other leg for about 90 degrees angle. Close your hands and from here we start with small movements to one side and to the other side. all balance exercises are great for our back. Again, the deep muscles, the deep abdominals and the deep back muscles have to work to stabilize the spine. Keep on breathing. Your back is straight. Your shoulders are far away from your ears, and small movements from one side to the other. Your standing leg is slightly bent. And then we change to the other side. Small movement from one side to the other. It's not an easy movement. Quite hard to hold the balance, but it's great to work on the deep muscles. Pull your belly button inside and small movements right and left. Great. We change to the other side again. One last time. We do a stabilization exercise, an exercise for our balance. Again, 90 degrees angle. You lift up your right leg and your right arm in front. From here, we let our pelvis drop and lift it up again. It's a really small movement, so we drop out and lift it up again. This is an exercise for the gluteus medius. The gluteus medius is a muscle just underneath your gluteus maximus, the big butt muscle, and it's often a reason for back pain. So because of our sedentary lifestyle and sitting too much, the gluteus medius tends to weaken. So it's very important that we do this kind of exercises to strengthen them again. So it doesn't result that we are getting lower back pain. So small movement up and down. Try to stay straight. If you need support, you can always support on a wall. You can do this exercise just standing next to a wall, and small movements with your pelvis. We're training here the left side. I can definitely feel it in my gluteus medius. And we change to the other side. Again, 90-degree angle, straight position. Contract your abdominals to hold this position, and then small movement, drop down and come back up again. Contract your abdominals. It's a nice balance and coordination exercise. The last ones. And relax. All right, now we continue on the floor. We start in the downward dog position. Stretch your heels in the floor. And we're starting with a nice mobilization exercise for the sacroiliac joints, the connection between our lower back and our pelvis. So push your heels into the floor. Feels really good. Try to keep your back straight. And from here, lower your knees on the floor. Your hands are underneath your shoulders. And we curve our spine. Make your back very, very round. And then come back into a neutral position. Breathe in. Breathe out. Curve your spine. Breathe in. Come back. We will do 4 small exercises to mobilize our whole spine and work on our back and abdominal muscles, as well the muscles of our pelvis. One last one. From here, we are looking now backwards towards our toes and come back. Look again to the same side. We're rotating to the side and come back. Keep your belly button pulled in the direction of your spine. Especially the small muscles around our spine, the intrinsic muscles are working. And one last one. Great. Lift up with your left hand, look behind your hand, and now dive underneath your other arm to the other side and come back up again. Breathe in, open up. Breathe out, come down. Breathe in, come up. Breathe out, come down. Another nice rotation exercise. We are mobilizing our spine, working with the muscles around the spine, our abdominals and back muscles. A slow, controlled movement. And one last one. Great. We repeat this small sequence one more time. So push your heels into the floor, mobilizing the sacroiliac joint. Keep your back straight. Your shoulders are far away from your ears. And pull your belly button inside in the direction of your spine. Bring your knees on the floor. Your hands are underneath your shoulders. And from here, we bend the spine, flex the spine as much as possible, and come back into a neutral position. Breathe in. Breathe out. Pull your belly button inside. You feel the stretch between your shoulders as well. Breathe in. It feels really good. Especially as well when I personally have some lower back pain while having my period. I like to do this exercise. It just alleviates my lower back. And one last time. Great. We do the shift to the other side. So look back on the other side. Come back to the center. Look back. Breathe out. Breathe in. Come back to the center. Your back is straight, and then rotate to the side and come back to the straight position. One last time. Good. Lift now up the other arm. Lift it up. And then bring it down underneath your arm and come back up again. Nice rotation for the thoracic spine. Breathe in, come up. Look behind your hand. Breathe out. Dive under your arm. And one last one. Great. Come back on all four. From here we continue with a small strengthening exercise. We lift up the knees and hold this position. Your hands are underneath your shoulders. Pull in your belly button. Contract your abdominals and hold this position. It's an unstable position, that's why all the deep muscles of our spine have to work to hold this position. Your head is an extension to your spine, looking downwards, and hold it. Keep on breathing regularly. Always keep your arms slightly bent. And the last seconds. And that's it. Great. From here we are continuing with a single leg lift. So lifting up one leg, hold it, and bring it down to the floor. We keep on this side, lift up, hold it, and bring it down to the ground. Which is very important if you have lower back pain, because a lot of times having lower back pain, the reason is a weak glute, a gluteus maximus, a weak gluteus medius, all the bum muscles and the muscles around our pelvis, because they are trying to compensate. Lift up and hold, and then come down. One last one, and we change to the other side. Lift up your leg, one straight line, and bring it down again. Pull your belly button inside, lift it up, and down. Hold the tension in the center, pull in your belly button, and work on the glutes, the hip extensors. They are the antagonists of the hip flexors, and the hip flexors are often the reason for back pain, as they are already overcharged, and that's why our glutes have to work more to get them some release to the hip flexors. Do it in your rhythm. Lift up and come down again. And one last one. Relax one moment. Sit back on your heels. Stretch your arms forward. We are relaxing our muscles and stretching the muscles of our back, the erector spinae. And then come back into the same starting position on all four, your hands underneath your shoulders. And we continue with a similar exercise. It will be a little bit more challenging as we lift up our arm as well. At the same time, the opposite leg. So we're lifting it up, then we bring knee and elbow together, and then lift up again. Breathe out, lift up your arm and your leg, hold it, and then breathe in, come together. Again, our glutes have to work, the lower back. If it's uncomfortable for you under your knee, you can always use a towel to put it underneath your knee. Do a small controlled movement. Great. The last three. Well done. We change to the other side. Lift up your leg, lift up your arm, try to stay in one straight line, and from here, come down, knee and elbow are connecting, and stretch up again. Your head is an extension to your spine, looking down. Your elbow is slightly bent. And the whole time try to contract your core. Pull in your belly button and hold the tension. Your hips stay aligned. Slow, controlled movement. Great. Stand with me with the last 2 repetitions. Good. We lower, we go down on the floor. We relax the upper body on the floor. And from here, start with a half Superman from the bottom up. So we start with the right leg, change to the other side, left leg. Small movement again, nice for the bumps. Our glutes have to work here. The hip extension. As I said before, a reason for the back pain are often tight hip flexors due to sitting too much. So we have to train the antagonists to kind of turn off the hip flexors, and the antagonists are on the other side of the joints, so the glutes are one of the antagonists of the hip flexors. Do it in your rhythm. You can relax your neck muscles, relax your head on the mat, and small movement up and down. Well done. Every side, one more time. Great. Next level, we stretch our arms from here. Lift up the left leg and the right arm and change again. Opposite. Arm and leg lift up, hold it for 2 seconds and then change again. Hold it up and change. Hold it up and change. It's a great back exercise. Pull your belly button inside to contract the stabilizers, our deep abdominals as well. Do as many repetitions as it feels good for you. You know yourself your best. You should never have pain while training. And the last repetitions. Great. Take your hands next to your chest. Push yourself up and sit back and straighten your back. Relax one moment. If you want, you can put your arms next to your body. Great. Well done. Now we can continue on our back, facing up. Lay down. Your arms are next to your body, and from here we start with a small pelvic tilt, meaning we are taking the hole underneath your lower back off by contracting our abdominals and tilting our pelvis. So we have this small hole and then tilting the pelvis. It's a small movement. We are working on our transversus abdominis, the deep abdominals, the deep layer of abdominals, which is like a belt around our spine. As well, our lower abdominals have to work during the posterior pelvic tilt. And we're working exactly on that movement, on the opposite movement, which causes back pain, because this anterior pelvis tick, this is often the reason for back pain. Now we are working the opposite, the posterior pelvic tilt. So breathe out, tilt, breathe in, come back. It's a small movement. Push your lower back into the ground. The last 2 repetitions. Great. We continue with a glute bridge, lifting up our glutes into one straight line, and then slowly, vertebra per vertebra, rolling down without touching the floor, and lift up again. Again, the posterior pelvic tilt up, and then slowly coming down. Breathe out, come up. Breathe in, come out, down. As before, we are working again on our glutes. So it's really important to train the glutes if you have back pain. Because if we have weak glutes, other muscles are trying to compensate, and this will lead to muscular imbalances, and that will cause the back pain. Obviously, there can be other reasons for back pain, but it's very common that muscular imbalances are one of the reasons for back pain. Breathe out, come up. Breathe in, come down without touching the floor. Great. One last time. Now we stay up here, contracting the glutes. Lift up your arms, and we start with small movements up and down. Now we're working as well on the tiny muscles around our spine, the stabilizers. You should feel it also in your glutes, as well I do. At least I do. Holding your pelvis up. Small movements with your arms. Small pedaling movements forward and back. Hold it a bit more. All our back muscles have to work. The hamstrings, the glutes, helping as well. And the last seconds. Great. Well done. Slowly, vertebra per vertebra, rolling down on the floor. And relax your muscles. We continue with an exercise for the abdominals. Therefore, take a small chair if you have. Otherwise, you can also push your heels strongly into the ground. The reason why we are using the chair is because we want to work again on our glutes and our hamstrings. So we turn off the hip flexors. Because, as I said before, one of the reasons is that we have back pain, that we have too tight overload hip flexors. So while training our abdominals, we don't want to train our hip flexors, so we try to turn them off. pushing into the ground or on a chair. So we contract here the hamstrings and the glutes. Now a small movement. Come up, breathe out, contracting the rectus abdominis, our front abdominals. Breathe in and breathe out. Come up again. We hold it for 2 seconds and down. Focus on your hamstrings and glutes, so you're pushing really down and come back. You have some space in between your chest and your chin. Your elbows are open. Breathe out, hold it a moment, and then come back down. A strong core, strong abdominals are very important to avoid back pain. It's all again about the balance, so we avoid muscular imbalances. So not one muscle group has to take all the work of another one. Breathe out with the effort. Breathe in, come back. Push your heels on the chair or into the ground to turn off your hip flexors. And one last one, hold it, and well done. Great. We continue with a pelvic curl. From here, we do a small movement, curling our pelvis up and come back down again. One function of the abdominals is the pelvis lift or the flexion of our trunk. So we're lifting up the bottom, so the lower abdominals have to work. Small movement up and down. The deep abdominals are working to stabilize the transversus abdominis, as well the lower abdominals to lift up the pelvis. And if we're lifting up the shoulders, our rectus abdominis is working as well. Last ones. Great. Stretch your arms, stretch your legs. Relax one moment. Good. We continue with a half roll up. Push your lower back into the floor. Your arms straight up and we roll up. And then slowly, vertebra per vertebra, rolling down again. Breathe out, roll up. Breathe in, come down. It's again a small movement. Try to push your lower back into the floor, contracting the transversus abdominis, protecting the lower spine, and then small movement up and down again. It's a great exercise for the abdominals. Stay with me, you can do it. Do it in your rhythm. Again, we are trying not to work on our hip flexors. At least not too much. We want to focus on the abdominals. One last one. Great. Come to the side position. We continue with an exercise for the gluteus medius. So, side, you stay in one straight line. From here, lift up the leg. Now pass it behind your midline. Your foot is pointing down. Bring it forward and then come back up again. Bend forward, knee towards the floor, and stretch up again. Also hold the tension in your center so you keep one straight line. As I said before, back pain might be a weak gluteus medius might be the reason of your back pain. So it's important to strengthen this muscle. Great. One last one. Well done. From here we continue in the side plank position. Your elbow is underneath your shoulder. Push yourself up. For more stability, you can always place one foot in front of you. And from here, lift your pelvis up. We are working here on the laterals, on the obliques, on the lateral side. And now lift as well, one leg up. Hold it here and come down. A small movement, up and down. If this is too hard, you can just hold the position like this. Keep on breathing regularly. If you want to challenge yourself more, small movement up and down. Again, nice work for the abductors here. Keep your pelvis up. And the last two. Well done. Come back down. I will do one more for the gluteus medius. We do the same position, but now we just do it statically. So we hold it here. Again, bring up your leg, past the midline of your body. Your foot is pointing down and lift it up. You can actually feel it, feel the gluteus medius, which is working here with your thumb. If you want, you can feel it and hold it. Hold this position. Keep on breathing regularly. If it's very hard for you, that's a sign that your gluteus medius is maybe a bit too weak, and you should do this kind of training more often. We hold it. Last seconds. Great. Well done. We obviously have another side as well, so we do the same movement on the other side. We start in the side position. Lift up your leg, past the midline, foot is pointing down, and then bend it forward and come back up again. You can hold your head or lay your head. Stretch up, come back down. Breathe out, lifting up. Breathe in, come down. Hold the tension in your abdominals to keep one straight line. The stronger your glutes are, the better it is for your back. Stay with me. The last two. Well done. Good. Side plank position, elbow underneath your shoulder. One straight line, lift your pelvis up. Hold this position. Again, focus to bring up your pelvis to keep one straight line. And if you want to add some more intensity, lift up one leg, up and down. I definitely feel that we did some gluteus training today. Breathe out, lift up. Keep your pelvis up. And the last ones. One more. Well done. Come down. Again, the static training for the gluteus medius. Bring your your leg up, past the midline, point down, and hold it here. Last hard exercise for today. Then we continue with some gentle stretching exercises. Stay with me the last seconds, and then you're almost done. Definitely can feel it. The last 5 seconds, come on. Okay, we continue with a nice back stretch. We did it before already. Place your arms next to your body and we're curving the entire spine, having again the posterior tilt of our pelvis. And just keep this position. Breathe in deeply and relax. And slowly roll up. And we make a big step forward. Left leg steps forward. We push the right pelvis forward, but without arching our back. So we keep some tension here in the center. Flat back. And push our pelvis forward. So we feel the stretch in the hip flexor of the right side. Relax your shoulders. Don't travel with your knee in front of your foot. It stays more or less on top of your ankle. Push your pelvis forward so you feel the stretch here in the hip flexors. Another hip flexor is the tensor fasciae latae, which is a big, thick muscle here on the side of your hips. Therefore, we are going to stretch it, bending to the side. So right arm goes to the left side. Try again. Keep the tension in the center so you're not hyperextending your lower back. We want to avoid that all the time. And then bend to the side, stretching the TFL, the tensor fasciae latae, one of the hip flexors. As I said many times before, one of the reasons of lower back pain are tense hip flexors. So it's really important that we keep on stretching them. Great. Shift your weight backwards. Stretch your front leg, and now with a straight back, slightly move forward. So you should feel the stretch in your hamstrings. Again, if it's uncomfortable for your knee, you can always place a towel underneath your knee. Try to keep a straight back and then lean forward until you feel a slight stretch on the back side of your leg. We hold the position a couple of seconds more. Relax your shoulders. And then bring your front foot backwards. We change to the other side. Big step forward. Again, your knee is on top of your ankle. Push your pelvis forward. Again, stretching the hip flexors. Try not to arch your back. Keep your back flat, but bending forward until you feel the stretch of your hip flexors. Especially if you're sitting a lot, it's really important to stretch up the hip flexors. We hold each position for about 30 seconds. Wait. And then the next stretch, the TFL, tensor fasciae latae. Bend over the midline to the side. It's a nice stretch on the left side. You should feel it on the left side of your hips. Relax your shoulders. Great. And shift your weight backwards with a straight back. Lean forward. You should feel it here on the back side of your leg. Great. We come back into a sitting position. Lay down. And we start with a small mobilization. Open your arms to the side. And with the left foot, we shift to the left side. With the right foot to the left side. Come back to the center with the left foot to the right side. It's a nice preparation for the next stretch. We are mobilizing our spine and our hips from one side to the other side. Try to keep your shoulders on the floor, on the ground. Breathe out. Come up. Breathe in. Come back. One last one each side. Great. And we stay on this side. Bring both legs together. Bend your legs together. Open your arms on the floor. We have a nice thoracic spine stretch here. Look to the other side to increase the stretch a little bit more. So legs are on the right side and you're looking to the left side. Breathe in deeply. It's very important that you always try to find out what's the reason of your back pain, as I said before. Especially if you have herniated discs, then this stretch is maybe not the best for you. So please, before you do any exercises and workouts, always try to find out the cause of your back pain. Come back to the center and we change to the other side. Try to keep your shoulders on the floor. Your knees are pointing to the left, your head to the right. Breathe in deeply. And then slowly come back to the center. The next is the stretch for the piriformis. We cross over, bend your leg and lift up your thigh. So the piriformis is the muscle deep located in the buttocks. And just by lifting up your leg, you should already feel the stretch in the piriformis. A tight piriformis could also be a reason for back pain. So I always like to include this kind of stretches if people or some clients have back pain. Great. We change to the other side. Lift up your thigh towards you. Whenever you feel the stretch, hold it there. Keep on breathing regularly and hold the position. As I said before, you should never stretch into pain. So only until you slightly feel the stretch. Great. And last but not least, you deserve a small massage for your back. Hug your knees. And we start with small circles and movements from the left to the right. It just feels really good. Again, we're working the posterior pelvic tilt. So we're stretching the erector spinae, the back muscles next to our spine. And it just feels really good. Good. From here, fall to the side in the fetus position. Push yourself up into the sitting position. Relax your shoulders. And that was our session for today. So how are you feeling? If you have a history of back pain or tend to have imbalances in your muscles or your core and pelvis, try to do those exercises as often as possible. Also try to focus in your daily life on good positioning, check your sitting position at your desk and avoid lifting heavy things with a curved back. Check out my other videos, subscribe to my channel and click the notification bell to keep up to date with our new releases. Also leave us a comment about how it was for you, so it helps me to design more videos that might be for you. Keep it healthy and see you soon.